شكرا جزيلا لوحدة التعليم المستمر بالكلية، سمحت لنا بهاي الفرصة نقدم. يمكن شوية نزحف على البريك، عذرا على التأخير، كل الشفت شوية زحف. Types of study designs. Today we'll talk about study design. So our lecture will include two main parts of study design, either interventional, we do something, or we observe. We call it observational. Observational, we don't intervene, just observe what's going on in the field. So interventional, they have different names. Could be experimental, could be clinical trials, could be quasi-experimental. Observational, we could have cross-sectional, we could have case control or cohort. Cohort either prospective or retrospective. I will talk about each one of those. So before we talk about the design, we need to take like quick review. What should we do before we conduct the study? First, we need to have research problem. We need to identify our problem. How can we identify our problem? We need to search in the literature. We need to go to online, search in PubMed or other search engine. We need to find the literature, the previous studies published there. Also, we need to have our hypothesis, our research question. Like for example, I need to identify the relationship between the age and hypertension. This is my research questions. I need the answer for this question at the end of my study. So I need to identify the data I'm going to collect. And finally, before I get started, I need to identify which method. We call it method design. So the method design here, it's the last one here in the preparation. I need to know which method I'm going to follow because it's my guideline. I should decide which method. So what's research design? Research design is a plan, structure, and strategy of investigation that help us to obtain answer. So it's a strategy, it's guideline. It helps us to find the answer. So I need to specify the specific study design, help me to answer my question. For example, if I have a specific question, I cannot choose the wrong design. The wrong design will not answer my question. So I need to identify the correct or the specific design. How can we decide the type of the study design? You will ask me, we have so many designs. Which one I'm going to use? It depends on your research question for sure. If you have experimental, you cannot choose cross-sectional. You cannot choose observational in pharmaceutics. You need lab-based, okay? But in my field, I may have observational. In clinical pharmacy, pharmacology, biochemistry, we may have something called observational without intervention. While in pharmaceutics, in chemistry, you need to do something in the lab. This is experimental. So it depends on your field, depends on your research question, depends on your hypothesis. You need to choose the design. Also, it depends on your fund, your facility, your instruments, your time, your resources. All these, you cannot choose to do something you don't have the device. So you need to choose the design, help you to answer your question with your available resource. Also, the time limit. I cannot conduct randomized control trial for 3 years. I need to graduate next year. So be practical, be pragmatic. Don't say, I will do 3 years randomized control trial and I need to graduate next year. So we have timeline. In diploma, we have 3 months. In master degree, we may have 6 months. In PhD, we may have maximum 1 year. So be practical in choosing the timeline. Types of study, as I mentioned, we have two main. Either interventional, I'm going to conduct something. I'm going to intervene. We also call it experimental or call it quasi-experimental. I will talk about this later. Observational, I don't intervene. I just record what's going on. This is observational. Also, we call it non-experimental. This chart summarizes what's in the types of studies available, either experimental or observational. Observational, it's really common in the, we call it social science. It's either cohort study, case control, cross-sectional. I will talk about this in a brief. Experimental design, we also call it in clinical pharmacy, clinical trials. Either uncontrolled, we don't have control group, or controlled, we have control group. Control group means people, they don't have the disease or they don't have the exposure. Those control trials, which is better in quality, we always need control group to compare our test group. Those control trials, either non-randomized, we choose them. Non-randomized, we choose them. We may have selection bias. If I choose, I may put the good group in my test group. So randomized, it's really helpful, and it's really the gold standard. Randomized control trial is the gold standard because I will avoid selection bias. The computer randomly assign participant into two groups. So if you ask me which one is the highest quality, I will say systematic review, the highest quality of studies. Systematic review, if you go to the literature, as Dr. Muwaffaq said, you need to conduct literature review. Literature review, systematic literature review, you use the same keywords again and again and get the same results. This is the highest quality. Randomized control trial on the top, as you can see, because it has randomization, it has control. Then non-randomized trial, less quality. Observational study, as you can see in the middle, and the quality. Then case series and case reports. Finally, expert opinion. If you go to the PubMed, you find something like one single author. They usually call it opinion or expert opinion. I will talk about I'm expert, but I didn't conduct like a study. So my opinion could be subjective. So keep in mind, always look for peer-reviewed journal with results. Don't go with the opinion without results. As time-wise, if you ask me how can we divide those according to the time, so I will say prospective in the future, like I need to follow up the patient in the future. Retrospective, I need to look to the patient in the past. I go to the chart, patient health record, and I will go from now to 2000, go back. This is retrospective. Prospective, I will follow up the patient from now to 2018. Prospective, future. Retrospective, in the past. Case control, also in the past. Cross-sectional, which is present now, the cross-sectional. Longitudinal, it's in the future. Control trial, it's also in the future. Control trial, all the control trials should be prospective. So this one is prospective, this one is a prospective. This one is observational, this one is interventional. I will talk about this. So let's talk about randomized control trial. Why it's the gold standard? It's called the standard because randomly I assign the patient into two groups, either treatment group or control. The treatment group taking the new medication. The control group, either they don't take medication, either placebo, or take the conventional one. For example, if I need to do a randomized control trial about valsartan, against what? I cannot leave patient without treatment, so I need to give them treatment, conventional treatment, which is cabotine. So new medications against conventional medications. I follow up those in the future. Every 3 months or every 6 months, I will measure their blood pressure, and eventually I will compare my control group against my treatment group. Which one healed better? Which one under control of blood pressure? So which one is the highest quality randomized control trial? First, randomized double-blind. Double-blind, I will talk about this later, but randomization, it's better quality because there is no selection bias. The computer assigned patient into control group, into test group. If I choose those without randomization, I will put the good healthy people in the test group. At the end of the day, when there is good result, I say, oh look, my treatment is better because those people like get healed better than control. But this is biased because there was selection bias. So under randomization, try to avoid all this selection bias. Randomized but blinded, not achieved. Blinding is better. The patient doesn't know which group, under which group. Both groups, patient, they don't know which group. They behave normally. They just take the pills. Imagine if the control patients know this pills is placebo. They will not take it. So I keep them blinded. They don't know if this pill has medication or not. This is the blindness. Non-randomization, less quality, selection bias. Randomized with deficiency in execution or analysis. Keep in mind, analysis Biostatistical analysis is very important. Why? If I conducted good quality study, at the end of the day, I conduct the wrong statistical analysis, I will end up with inappropriate results. So biostatistics is one of the key components here to try to help us to execute the high quality studies design. So look here, the randomized control trial is on the top, then cohort, cross-sectional, case control, and case series. Randomization could be conducted by the computer, could be conducted by hand, but keep in mind, don't select those by yourself to avoid the bias. Single blind, only the patient doesn't know if this is treatment or placebo. Double blinded, both, even the researcher, they don't know, because the researcher, if they know, they will take care about the test group better than control group. So you will ask me, who will collect the data? There will be third party. There will be biostatistician who will collect the data. So you cannot manipulate the data. Double blinded, you cannot manipulate the data. This is the good things in the high rank institution. Crossover experimental design. This is one part of experimental design. It's randomized control trial. But in this case, in the previous study, we have control, we have test. The patient in the control, they stay in control. Patient in the test, they will stay in the test. And this one, we will switch. We have two periods. The first period, the control group, and the test group. After second period, after 3 months, the test will be control. The control will be the test. So this is the crossover. We will every participant will be patient and will be controlled at the same time. This is just crossover, one type of randomized control trial. Quasi-experimental study, it's natural or semi-experimental study. We don't intervene by ourselves. For example, if we here in the College of Pharmacy try to apply the clicker, if we apply the clicker, I will not fund the clicker. This is not my experiment, but the institution applied the clicker. I will come as a researcher. I will say I will do research. The intervention already conducted by who? By the institution, not me, not the researcher. I will conduct survey at the end of the year about using of clickers. This is the pre-test, then the test, which is the intervention, the clicker. At the end of the year, the post-measure. So I will not intervene, but the intervention already done by the institution. Like our hospital implemented the new electronic health record. I didn't intervene, but they implemented. This is intervention. This is natural or semi-experimental design. I need to have measure before the intervention, which is a pre. I need to have one after. Always keep in mind, I need control group. I need someone, other group, other institution, they didn't apply this. I need to compare with it. Always keep in mind, control group, higher quality. Without control group, only tested, lower quality. Always pre-test, post-test, better quality than post-test. احنا جماعتنا هنا يستخدم دواء ويقيس فقط بعد الدواء. هذا الشيء مو صحيح. We need to measure the baseline before the treatment and follow up after the treatment to get higher standard. So for the experimental, like is observational. For experimental, we have randomization. Observational, we lack the randomization. This is one cause of low quality. Observational, we cannot randomize people. They have exposure. They already done. So no randomization, lower quality. This is observational study. This is experimental. High quality, but it's more expensive. Keep in mind. Usually those prospective. So for the observational, cross-sectional study, all the survey, it's cross-sectional. We measure, we ask you a question now. How do you do now? Are you okay? You will answer, I'm okay. But tomorrow you will be not okay. For example, so I'm asking you about now, which is the present, the snapshot for today. This is cross-sectional. In the present time, just for now, snapshot. Keep in mind, cross-sectional, present, one-time measure, not follow-up. Cross-sectional, such as survey, single point. The strength is, it's easy. I'll just distribute survey for you now. It's easy to collect. But for a weakness, I cannot say if you have this disease or the disease caused the exposure, keep in mind it's low quality. It's easy, low quality study. How can we compare case control against retrospective study? For the case control, we are here. We know the we know the exposure, the disease, but we don't know the exposure. For example, if you go and in the medical chart you find patient with the cancer, you will go back in the history, say if this patient exposed to pesticide or not. So I will find the cancer first, the disease. I will go back to find if this patient exposed to uranium, depleted uranium, or pesticide. Retrospective, we are also here, both are retrospectively, both retrospective in the past. Retrospective, we found the exposure. We found the depleted uranium exposure, and we follow those patients. We found if they develop the cancer or not. So it depends. Here we are looking for the disease. Here we are looking for the exposure. Both retrospective, both observational. So we have cohort study. Cohort, we have group of people, follow up them in the time, either retrospective or prospective. Either exposed, they have pesticides, use pesticide, or not exposed. Then we'll follow up them in the time if they develop the disease, the cancer or not. So you need to have exposure. After the exposure, you measure the disease. You cannot say this is the disease due to the exposure if you don't know when the exposure. So causation means you need to have the exposure before the disease. Cohort study, group of people, we divided them into two groups, follow them up in the time. So how can we compare the retrospective against prospective? Retrospective, I'm now in 2008. I will go back in the archive, looking for the archive patient record in the hospital, looking for all the records for this patient since 1988. Go back in the time, okay? This is retrospective. Prospective, 2008, I will follow up them in the future. So follow up the exposure and the disease in the future. This is the prospective. Which one is easier? Which one is less expensive? You will ask me. This one, why? Because the data already available. I will not spend time to collect data. It's already there. It's already collected. While this one, I need to wait. I need to follow up the patient, and the patient may skip. I may lose the follow-up of the patient. Keep in mind, this is more expensive, more time-consuming, but it will get me more data. While the retrospective, I will limit it only what's available there. This is the main difference. So in the prospective, we have example about 17,000 nurses, and some of them, they are obese, some of them, they are thin or lean. I follow up them in the future if they develop any disease or cardiac disease. This is the follow-up. I will follow up those nurses from now 10 years in the future. This is prospective. Retrospective, I will go to the record of the tire makers and clericals, دول اللي يعملون بالأوفيس. أشوف اللي يعمل بس شلون أرجع لهم الداتا already there. يعني الشارت مالهم already available. So it's already there. It's less expensive, but I go in the past. So what's the main difference between those two, prospective and retrospective? For the information, which one is the most complete one? Prospective, because I have control over the information. I can collect any data I need. While in the retrospective, it's already there. I cannot change it. It's already there. So I will lose information. I will be limited. تقول لي هاي موجودة بالطبلة ما نجيب لك بعد الاسم ما مكتوب الوزن ما مكتوب الفيتال ساينز ما مكتوبة. For the cost, for sure this is less cost. By single visit I can go back 1 year. But here I need to wait 1 year, transportation, waiting, connect. Finally completion time, this one is for sure it's shorter. This one it's longer. I need to wait in the future, okay? So in summary, choosing appropriate study design. Which studies design I'm going to choose depends on my research question. If I need to measure the prevalence, I need to use cross-sectional. Incidence, it's new cases. Prevalence, it's available cases. Available cases of hypertension, for example. Incidence rates, new cases of hypertension. prevalence cross-sectional, incidence longitudinal, causation, risk and prognosis, case control or cohort study or randomized control trial. Any one of treatment efficiency. هسه انت تقول لي الاف دي اي ايش تعتمد؟ الاف دي اي كل كلها تعتمد راندومايز كنترول ترايل. ما تقردوه اذا ما يقول يجي الباحث يقول له انا سويت 3 phases of randomized control trial على هذا البحث. انا سويت فولنتير وكلها راندومايز كنترول ترايل. اف دي اي ما تعطي ابروفال اذا ليش؟ هي الجولد ستاندرد. كلها تسوي دبل بلايند راندومايز كنترول ترايل، فكلها اذا تريد تقيس الافشنسي مال نيو ميديكيشن، تريد تقيس الكوست افكتفنس، الدايجنوستس تيست، كلها راندومايز كنترول ترايل. هي الجولد ستاندرد. عندنا فيس 1 وفيس 2، فيس 3 طبعا يزيد بعدد الفولنتير ويا الوقت، بس المهم خلي بالك هي الجولد ستاندرد. وفاينالي summary of the study design as just summarize types of study, either experimental, which is the interventional, I will intervene. Also, we have another type, we call it quasi-experimental, which is natural. Or we have crossover. The observational, we have the cohort longitudinal, which is more than one measure. Case control, we have cases with disease, control without the disease. Those in the past. Cross-sectional, which is snapshot, which is the survey, just for now. This is the easiest one. Ecological, it's out of my scope for today. I didn't talk about it, but it's population based. So we have either interventional and observational. And thank you so much for listening.